Hello, I'm Peter Chan from the Harbour's Medical Practice, and this is a short video about indigestion and why it might be sensible to have a try off some of the medication that you've been prescribed for it. There are some new concerns about some side effects from these classes of drugs. So we'll talk about what those concerns are, what else you could do instead of taking a medication. So what drugs are we talking about? Well, we're mainly talking about PPIs, or proton pump inhibitors. These are drugs like omeprazole, lansoprazole, pantoprazole, rabeprazole, or esomeprazole. They work by reducing the amount of stomach acid that cells in your stomach produce. We're probably not talking so much about medications like ranitidine, and we're definitely not talking about medications like Gaviscon or Peptac. I used to think those worked by coating the lining of your esophagus or stomach, but they actually work more by just sitting on top of your stomach contents to stop them bubbling up into the esophagus. And they also have a smaller acidity neutralizing component, their dual action. And these seem to be a safer alternative, but you need to take them after every single meal and before you go to bed. They don't really work if you just take them when you've got a bit of discomfort. Well, some studies have estimated that up to 7 out of 10 prescriptions for indigestion drugs might not be necessary. So who should still take them? Well, there's not that many categories. The first is if there's been something really quite severely wrong with your esophagus or food pipe, like severe inflammation, ulceration, stricture or narrowing, or a condition called Barrett's esophagus, where some of the lower cells change in response to exposure to acid. Well, you should still take them. Or if you've had a previous stomach or duodenal ulcer, well, you should still take them too. Otherwise, there are certain rare conditions that we learnt about at medical school and then quickly forgot because we never saw them, such as Zollinger-Ellison syndrome. But otherwise, it's people that are at particularly high risk of bleeding from the upper gastrointestinal tract. Usually those are older people who are on high doses of anti-inflammatory or steroid medication. But sometimes we're a little bit too cautious with this group of people too. If you're not sure, ask your doctor. But for most other people, it is entirely safe to have a try off your indigestion medicine. Well, the first new concerns about PPIs reflect our immune system. We've known for a while that if you're taking them, you're a bit more at risk of a pneumonia. But studies from COVID suggested that you may be 2 to 3 times more at risk of contracting COVID. We don't really know why, but it may be that stomach acid that's being reduced by these medications plays a really important role in denaturing or dissolving virus particles that could get into our bodies and cause an infection. And we know that this acidic environment created by our stomach acid is really important lower down in our intestines as well. If you take a PPI medication, you're more at risk of upsetting this environment and creating conditions like small intestinal bacterial overgrowth or infections like Clostridium difficile, where particular bacteria are allowed to overgrow and can cause gut symptoms like pain and diarrhea and can be very difficult to treat. Well, one of the other problems with medications like PPIs is that they reduce the release of certain macronutrients like magnesium, sodium, and particularly vitamin B12. We used to get our vitamin B12 by eating vegetables that grew in the soil. But now that we buy our vegetables wrapped in plastic and not soil, we actually get most of our B12 by eating animals that eat the vegetables that grow in the soil. So if we take a medication that reduces our stomach acid, we reduce our ability to dissolve up that meat and release the vitamin B12. And that can make us feel really ill. Well, the third area of concern is a link between PPIs and an increasingly long list of chronic diseases. We certainly know about osteoporosis, where there's a reduction in bone density and therefore an increased risk of fracture. It might be due to problems with calcium absorption with a reduction of acid. But PPIs have also recently been linked with diseases like chronic kidney disease and even dementia. We certainly don't know whether these links are proven, but it certainly causes concern. So what else could you do if you're getting indigestion apart from taking a medication. Well, in terms of what foods to avoid, you hear a lot about spicy foods, but it's really fatty foods that are much more likely to trigger indigestion and heartburn. What are the things I have to do? There was a study looking at chili peppers that showed that actually eating chili peppers could protect you against indigestion and heartburn, maybe because you just get used to a degree of discomfort. Well, we're up early in the morning, and the timing of when you eat is really crucially important. Your gut motility is far faster in the morning. So the old adage, breakfast like a king, lunch like a prince, and dinner like a pauper, unfortunately really holds true. And paupers never eat more than 2 to 3 hours before they go to bed. They're going to lie horizontal, and any acidic stomach contents are going to spill up into your esophagus. Well, I'm afraid when it comes to what to drink, fruit juices, coffee, fizzy drinks and alcohol can be considered the 4 horsemen of the dyspepsia apocalypse. Unfortunately, it looks like quite a good day to me. So we're lying in a field of pure gluten to encourage you to try and experiment by removing things from your diet that you think might be contributing to your indigestion. Some common things are gluten and dairy products. So just excluding them for a couple of weeks is usually enough to see if you're going to feel any better. Well, finally, if you do choose to try and come off your PPI medication, this is just a reminder to do it gradually, step by step. You're far less likely to get a rebound increase in stomach acid production, and you're far more likely to be able to stay off the medication in the long term. Best of luck.